Hello, everybody. My name is Idiomi Enebong. Thank you for taking the time to view this presentation. For my project proposal presentation from NSC A92, my topic will be focusing on a form of psychotherapy known as cognitive behavioral therapy, also known as CBT. My research is in older adults over the ages of 65 diagnosed with anxiety and depression, and how providing CBT affects the signs and symptoms associated with anxiety and depression within 3 months of use. Healthy People 2020 explained that mental illnesses, which includes anxiety and depression, is the most common cause of disability. Mental health and physical health are closely connected. Mental health plays a role in people's ability to maintain a good physical health. Mental illnesses such as depression and anxiety affects people's ability to participate in health-promoting behaviors. In turn, problems with physical health such as chronic diseases can have a serious impact on mental health and decreases a person's ability to participate in treatments and recovery. Depression is projected by World Health Organization to be the second leading cause of incapacitating diseases by 2020. Depression is the leading cause of disability worldwide and is a major contributor to the overall global burden of the disease. Close to 10% of the world's population is affected, and mental disorders account for 30% of the global non-fatal disease burden. Between 1990 and 2013, the number of people suffering from depression and or anxiety increased by nearly 50%, from 416 million to 615 million people. World Health Organization has listed cognitive behavioral therapy as an effective treatment for depression and anxiety. This statistical data goes to show that the rate for depression and anxiety are alarmingly high, and evidence-based practice will be conducted to determine if cognitive behavioral therapy will be effective in treating anxiety and depression. My intervention study will consist of both males and females ages 65 years and older who have been diagnosed with anxiety and depression. The purpose of this project is that hopefully a determination can be derived from this study that will confirm that the use of cognitive behavioral therapy will lead to a decrease in signs and symptoms of anxiety and depression and will increase quality of life for the target population. Given the negative consequences of anxiety and depression in older adults, interventions such as cognitive behavioral therapy may help reduce risks of negative outcomes and provide a lasting benefits for older individuals. The literature available regarding the use of CBT indicates positive results and better patient outcome. Many studies, including randomized controlled trials, have been completed, and most of the results confirm that there's a decrease in symptoms of anxiety and depression with the use of CBT. In studies such as randomized controlled trial carried out by Garcia Pina, the participants were required to be at least 60 years and older and suspected to have deep depression. 50 participants were assigned to the control group and 41 to the intervention group. The intervention group received CBT for once a week that lasted for about an hour and a half, lasting for 12 weeks. The study used a patient health questionnaire, also known as the PHQ-9, to measure intervention effectiveness. Effectiveness was defined as a decrease of at least 5 points. After 3 months, 56% of the participants displayed a decrease that was greater than or equal to 5 points on the PHQ-9 scale, compared to only 30% in the control group. A similar study was carried out by Wickrick and Reed. In this particular study, participants had to be at least 60 years old with with both anxiety and depression. They were randomly allocated to either a control group or an intervention group. Those in the intervention group received CBT once a week for about 2 hours over a 12-week period. On the other hand, those in the control group continued with their usual treatment. After 3 months, the intervention group showed a great reduction on symptoms of anxiety and depression than the control group. The World Health Organization has listed cognitive behavioral therapy as an effective treatment for depression and anxiety. Therefore, cognitive behavioral therapy is a proposed intervention that will be implemented to address this problem. For this particular project, participants will be assigned to treatment groups that will be 12 weeks in duration. The program includes generic CBT skills, including a psychoeducation, problem solving, cognitive reconstructioning, and sleep hygiene, and graded exposure, which is a core skill for treatment of anxiety, and activity scheduling, which is a core skills for treatment of depression. Due to the transdiagnostic aim of this program, all skills will be presented with examples for depressive types of problems and anxious problems, mainly worrying or social evaluation concern. Similarly, graded exposure will be presented with examples for a range of anxiety problems, including worry, social anxiety, and specific phobias. Cognitive reconstruction is a core component of the program and will be introduced over a course of 4 weeks and then practiced as homework each week, with considerable attention paid to establishing links between thoughts and feelings. At the end of the 12 weeks, participants will again complete a post-treatment assessments, including diagnostic interviews, cognitive assessments, and questionnaires. Each participant will be evaluated using series of evaluation tools, such as the Geriatric Depression Scale, which would measure symptoms of depression in older adults, Geriatric Anxiety Inventory, which will measure anxiety symptoms in older adults, the PHQ-9, which of course will be used to measure reduction in depression, and the intervention effectiveness will be defined as a decrease of at least 5 points on the PHQ-9 after 12 weeks. These tools will be used to assess the severity of anxiety and depression. The participants will receive this assessments at the beginning of the study, right after the study, as well as 3 months post-CBT. The results of these assessment tools will determine if the severity of the depression and anxiety symptoms have decreased. The analyzed data from these studies will determine if the use of CBT shows a significantly better outcome as compared to when the participant first started the study. Based on the research finding demonstrating how well CBT works along with anti-anxiety and antidepressant medication, it is important that the psychiatric mental health nurse practitioner implement CBT when formulating a care plan for the patient diagnosed with anxiety and depression. Thank you very much for your time.